5 seconds. Mute your phones. All right. Good afternoon, everyone. It gives me great pleasure. I'm so excited to introduce my lab, the Mother Lab, the largest lab in the country, the Maternal Outcomes for Translational Health Equity Research Lab. You will hear from some of our amazing members, some of our leadership team about the work that we're doing. The Mother Lab was started at the height of the pandemic in July 2020 to really address maternal health inequities, as we saw one playing out in COVID, but two as part of a larger maternal health crisis. In our 2 short years of being around, we have done some incredible programs. We have some amazing things lined up. You will hear from the leadership, you'll hear about our strategic planning, and you're in for a real treat. So with that, thank you so much for Mother Lab. Thank you to our audience for being here, and you have the floor. And Ava, you can start the slides. Thank you.
Hi there, everyone. My name is Blessing Lawrence, and I'm one of the co-chairs for the Mother Labs Research and Grants Committee. Next slide, please. Just a little overview on the makeup of the Research and Grants team. We are a diverse group of researchers and students, and we have about 4 graduate students, about 3 lovely undergrad students, 4 working professionals, and 1 postdoctoral scholar. And we're diverse in terms of educational background and other identities as well. Next slide, please. So the mission of the Research and Grants team is really to focus on being a diverse group of researchers and students who seek to produce evidence-based practices and programs that aim to uplift maternal health and reproductive justice. Our main objective is to call out and eradicate systemic racism, improve maternal health outcomes within communities of color, and to promote the implementation of policies that pave the way to health equity. Next slide, please. So since the launching of the lab in 2020, we've accomplished a few exciting things. One of them is we submitted a testimony to Congress in November of 2020 on the state of the U.S. Maternal health crisis. We also applied to 2 grants, and we were awarded about $52,500 from the Churchill Health Foundation and Health New England. We have presented some of our work at conferences. We went to the American Public Health Association conference in 2021, and we also attended the Association of Maternal and Child Programs annual conference as well. At that conference, we presented a systematic review on Black maternal health policies from 2010 to 2020. We also presented that same work at the Academy Health Conference as well. Next slide, and over to you, Allison.
Thank you, Blessing. Good afternoon, everyone. My name is Allison M.O.T.H.E.R, and I'm also a member of the Research and Grants Committee. I want to take some time today and highlight a few of our committee's accomplishments thus far. Our most recent publication is featured in the Maternal and Child Health Journal and Frontiers in Public Health, where we looked at the effects of psychosocial influences on Black maternal health during the pandemic and conducted a systematic review of Black maternal health federal policies in Massachusetts. We also published a book chapter titled The Color Line of Infertility, Reproductive Disparities in Black Women, which talks about the role of intersectionality in Black women's health and resilience in navigating public health systems. We're also really proud of the PRAMS analysis projects that we worked on, which stands for Pregnancy Risk Monitoring Systems. And this was a data set we obtained from the CDC. And we published a paper on the impact of psychosocial stress on maternal health outcomes. Next slide, please. We have 2 more papers on the way using PRAM's data set, where we did a cross-sectional study examining the smoking patterns of women who experience major life events, psychosocial stressors, and the impact of psychosocial stressors on maternal morbidity and racial disparities. And within our research and grants committees, we continue to challenge ourselves, taking on a multitude of projects. And right now, we are examining a data collection called the Teens and Tots Program Evaluation. And we received this data set from Boston Medical Center. This is a pretty large data set that we're analyzing, and We're looking at the underlying disparities and different health outcomes of mothers through this program, which predominantly consists of low-income patients, immigrants, and people of color. This is only the beginning of what's to come for the Research and Grants Committee, and we're so excited for what we have in store for the future. We continue to strive to get our hands on more data sets, put out more papers, and continue to shed light on the Black maternal health crisis to help improve health outcomes for all women of color. Next slide, please.
For any questions, please feel free to email the Research and Grants co-chairs, myself, Carrie Cavajo, and Candace Stewart, and we'll be happy to answer those questions. Thank you.
Okay, next up is the community engagement. Thank you, Iman. Thank you, Lauren.
Hi, I'm Lauren Cohen. I'm one of the co-chairs of the Community Engagement, Advocacy, and Policy Committee.
And I'm Iman. I'm also a co-chair of the Community Engagement, Advocacy, and Policy Committee, seniors at Tufts.
So the mission of our committee is to provide outreach and education surrounding maternal health. We're really invested in creating and strengthening relationships with community partners through collaboration, as well as hosting panels and other events where we can partner with these community members. We strive to stay informed of current state and national legislation regarding maternal health, and we continually strive to educate the public on relevant policies with an end goal in improving relevant legislation. Next slide, please. So the Community Engagement Subcommittee is one of our three main branches in our committee. So since the founding of the lab in 2020, we have a number of accomplishments, such as organizing a birth workshop that connected attendees to doulas and birth educators. We hosted a webinar that highlighted several different career paths in the maternal and reproductive health spaces. We developed forums to kind of build relationships with community partners and to allow for more collaboration. And in addition to that, we cultivated connections with doulas, birth educators, and other organizations that we can mutually support. Some of our ongoing projects include nurture kits, which we are putting together for expecting parents. And we are currently in the process of raising money for and getting donations for these birth kits that will be provided to low-income women. And in addition, one of the members of the Community Engagement Subcommittee sits on the planning committee of the Boston Black Breastfeeding Coalition, which organizes events for the annual Black Breastfeeding Week in August 2022. In the future, we hope to collaborate more with March of Dimes, which is one of our main community partners, to raise awareness on maternal health issues and policy. We plan to hold Instagram Live discussions during multiple different weeks throughout the year, including Black Maternal Health Week. Because of the success of our birth workshop earlier this year, we hope to organize and hold more workshops in the future. And we also hope to work with a milk bank in the Boston area to support mothers who are unable to provide milk for their babies. Next slide, please.
Hi, everyone. I'm Amaya Menta, and I'm a sophomore at Tufts University, and I'm part of the Advocacy Subcommittee of the Community Engagement, Advocacy, and Policy Committee of the Mother Lab. One of the main goals of the Advocacy Subcommittee is to amplify the voices of Black mothers and Black birthing people. So one of our biggest accomplishments this year was actually publishing a podcast that's available on Spotify and RSS.com, which can be found by searching up Mother Lab Podcast if you're interested in viewing some of our episodes. Our episodes are focused on partnering with people throughout the United States, and we focus on issues that plague Black birthing people throughout world. Some of our episodes have focused on doula care, have focused on lactation consulting, and also abortion disparities providers. Some of our recent accomplishments were publishing the first ever podcast on Spotify, publishing our Mother Lab blog post, and we also were able to conduct an interview with the Coalition of Abortion Disparities Providers that included Dr. Farinaz Khan, Dr. April Lockley, and Dr. Dalia Brahmi. We were able to understand more about the inequalities that exist in abortions disparities throughout the United States. We also had a member who was accepted into the United Health Foundation and Diverse Medical Scholars Program to improve women's health amongst low-income and people of color populations in Texas. We were also able to contribute to a larger project on HPV by creating infographics and flyers. Right now, we are working on transcribing and writing a commentary based on our interview with the 3 doctors that I mentioned before, and we are also continuously working on blog posts that can be accessed at the motherlab.org. In our future endeavors, we hope to do some more cross-collaboration with marketing and communication, and also synthesizing our findings from the podcast that, again, is available on Spotify if you would like to listen. Next slide.
Hi, so our third subcommittee of this committee is the policy committee, where we have had a lot of accomplishments since our launch in March 2020. We have been able to publish a number of different newsletters that focus on different areas in reproductive health. So we began with looking at racial inequities in maternal health, as well as the inauguration of the Biden-Harris administration in June 2021. We also looked at the abortion disparities that was happening when the abortion bills were changing, and we were able to raise awareness on the different impacts it was having and the disproportionate impact on Black women. We also then were able to move on to the Momnibus, postpartum, and our most recent one was on reproductive rights. Throughout the 2 years, we have been able to write different testimonies as well as attend a number of virtual hearings. Some of the bills include We Push for the Femur, which is a fetal and infant mortality review. We also wrote a written testimony for the Medicaid coverage for doula services, as well as COVID-19 vaccination and making it more equitable. A recent one was the Black Women and Girls Act of 2020 that we were also able to work with the Community Action Network. In terms of our other policy support, apart from written testimonies, we have also written a Mass Health 115 waiver request extension, which was to extend postpartum coverage post-pregnancy. And we further advocated for the fetal and infant mortality review that is still to be enacted in Massachusetts, but has recently passed the Ways in the Public Health Committee. Next slide, please. And then in terms of our policy committee, collaborations are really important to help us amplify and advocate for Black women. So we have worked strongly with the Community Action Network, as I mentioned before, for the fetal and infant mortality review. And we have frequently met with March of Dimes, where we advocate for the Momnibus Act specifically. And they also have an advocacy campaign that was in March as well as in May in Massachusetts that we will all be attending. As Amaya mentioned, we have worked strongly with the Abortion Disparities Group, and we were able to interview 3 doctors, and will now be publishing commentaries on our interview work to highlight the key takeaways. In terms of the future of our committee, we also hope to continue to publish commentaries, email legislators for the MHQI Improvement Act, as well as keep publishing our newsletters to highlight the disparities that affect Black women in the reproductive health domain. Thank you.
Great. Next, we have the Marketing, Communications, and Events. Brenna.
Hello, everybody. I'm Brenna. I'm one of the co-chairs of our Marketing and Communications and Events Committee. Next slide, please. So our committee is particularly focused on disseminating the most up-to-date information regarding Mother Lab and Black maternal health. One of our main goals is to inform and educate our followers on our research and activities, as well as providing opportunities to learn more about the current status of Black maternal health in the United States. So we're dedicated to creating an inclusive space for everybody to learn and engage with our lab, and are committed to building a supportive and informed community. One of the ways that we do that is by developing resources that we send out on all of our social media that is then also available for free on our website, so it's easily accessible. Next slide, please. I'm going to hand this over to Kalechi.
Hi, everyone. I'm Kalechi. So these are some of the current members in our committee right now. So we have Brenna, myself, Paige, Beverly, Divine, Lily, Raya, and Hadia. We're all from different backgrounds. But still having like the same goal of becoming better maternal health advocates. Next slide, please.
So some of our really important accomplishments over the past year is that we've grown our social media. It's been skyrocketing with engagements. So we've had over 150,000 total views across all of our platforms. The last time I checked, we had 1,300 followers, though that has been shooting up throughout this conference. We also help collaborate with the conference and obviously promo it. So when you see all of the posts about the conference on Twitter, Instagram, all of that is our committee. We have also been featured as a lab on the Necessary Trouble podcast and the Nonprofits podcast, with Dr. Ao also being featured in Vice News, The Lancet, and PBS Rhode Island. And one of our signature products, signature deliverables, is our themed infographics. So these are our educational resources that go out on our socials and are also found under the resources tab of our website. Some of the topics that we've covered have been Black History Month, midwifery, infertility impact on Black women, fast facts on maternal health, and one of the most recent ones that we've published was an updated maternal health mortality terminology vault. So that just came out this past week. Next slide, please. We also write all of the newsletters that come out of the lab as a whole. So we have an introductory newsletter, a winter newsletter, and a one-year anniversary newsletter. All of those can also be found on our website and are available to download if you'd like to go through those. We've also hosted a Pride event with some notable guests, including Frankie French, Blacklight, a New York City realtor, Blacklight comedy show organizer, Lois Thompson, and the CEO of Mobilize and Queer Business Alliance founder, Jade Varonsky. So shout out to those guests who collaborated with us. And the last thing that we've really accomplished is, alongside the Community Engagement Advocacy and Policy Committee, we work very closely with them. We organized and enacted a social media campaign regarding Governor Baker signing and passing the maternal health bill, H4818. So we've been advocating for that on our socials and on our website. Next slide, please.
So some of our upcoming projects for the remainder of the year is our Pride Month content. We're trying to push out content that focuses solely on Black trans and Black non-binary people. We're focusing on educating the public and pushing our community to be an educational source for others. So we'll be posting on all our social media platforms, especially our TikTok account, which is at mother_lab. So definitely follow us and keep and be engaged with our lab. We also have some doula content coming out soon. We have some doulas within the lab where we're trying to make like a general toolkit or just disperse like general doula information to the general public. And then we will also be creating content for National Breastfeeding Month. So we're going to be posting information on lactation consulting through a possible infographic series. So all of these things can definitely be found on the resources tab on our website, which is motherlab.org. So we're trying to serve as an online resource for any birthing person. Next slide, please.
So if you guys want to reach out or engage with us on any of our socials, this is all where they can all be found. We do also have a TikTok, which we've just launched pretty recently. So make sure to follow that as well. And if you guys have any questions, you can feel free to email us at info@motherlab.org, or feel free to DM us via any of these platforms, and we'll try to get back to you as soon as we possibly can. And thank you for engaging with us on our social media.
Thank you.
Great, thank you. Next up, we'll hear from Heather Olden, a member of the lab, who will talk about what we're doing in our strategic plan. Heather, I think you're muted. I can't hear you. Anyone else? Can anyone hear you? Okay. Heather, just keep trying, and I'm just gonna go ahead and do the slides. Okay. Okay. Just log out and come back. It's okay. Thank you, everyone. Okay, so Heather led us through the strategic planning process, and this was a really in-depth opportunity for us to think about where we're going as a lab, some of the things that we want to prioritize, how do we want to focus our next year, and what are the things we need to be able to keep at the front of our mind. And so this was a process that was very, very comprehensive, very, very in-depth, and we've done it a couple times in a couple iterations. And so we went through the process of gathering information. Stakeholders are obviously members of the lab, going through what are the strengths of the lab, what are the weaknesses, where are the opportunities for strengthening the work we're doing, and where are some potential threats. And then after we did that, we went and
I'm back.
All right. I'm turning it back over. Thank you.
Sorry, everyone. So I have a background in strategic planning, and so I was honored to be able to do some strategic planning for the lab. So this just is an overview of our strategic planning process. We gathered information, we did an environmental scan, gap analysis, we did a really great SWOT review, SWOTs, which is strengths, weaknesses, opportunities, and threats. We reviewed that, and then we did some work on sort of taking what we learned from the SWOT and making strategies and goals, defining metrics, and of course, seeing if we had resources already in our reach or maybe resources that we need to go and find. We are now implementing that strategic plan. And then you'll see here in the last column of Monitor, in January of 2022, we had a phenomenal retreat where we were able to review our strategic plan and really take a step back to say, are we doing what we said we wanted to do? And maybe there are parts of the strategic plan that we want to adjust. Next slide, please. Oh, and these are my animations. So the next time we'll check in is July 2022. This is the first page of our strategic plan. These are the mission, vision, and values and the goals. I'm not going to necessarily take time to read it, but this is available, I believe, on the website. And if not, it will become available. But this is really our guidepost for us. What are we doing to make sure that we're aligning with our mission, vision, and values, and then also with our 6 predefined goals? Next slide, please. This is our organization chart as well as our lab framework. And so as you saw with the previous committees, the engagement, the community engagement, advocacy and policy, marketing and communications, and research and grants committees, they all work together. And then we have sort of this ring of mentorship and ring of writing to sort of bring everything cohesively together. Next slide, please. And so this is our strategic plan. This is the first page, and it's broken down into internal and external efforts. This is what you're seeing is the internal. And so each column represents a different focus or a pillar. So we have networking and collaboration, exposure and dissemination, professional development and training, and fiscal support. I'll take a second for you to see, we want to collaborate across committees, we want to increase member engagement. Of course, just like our marketing committee just talked about, is sort of increasing our social media traffic and digital footprint, as well as bringing more traffic to our website. Professional development, iron sharpens iron. We want to learn from one another, but also bring in people who could also teach us things to strengthen the Mother Lab. That includes webinars, trainings, things of that nature. And of course, fiscal support is important. And so we are always thinking of creative ways to incentivize participation for members and make it so that it's really a cohesive, compensated environment for all of the members. Next slide, please. This is the external piece. So not only are we collaborating internally across committees, but we want to collaborate with other organizations and institutions, not just in the Boston area, nationally as well. We, of course, want to increase our abstracts and publications and conferences, which you saw in previous slides. And we want to fortify community engagement and our relationships, with which the Community Engagement, Advocacy, and Policy Committee is doing a phenomenal job. Additionally, we want to have some mentorship Internally within the lab, you've noticed from the first couple of slides that we have undergrad, grad, but also find mentors outside of the lab to come in and really strengthen our skills. And then finally, we are looking to acquire additional support from Tufts, fiscal support from Tufts, as well as external funding. We'll always welcome more money. And so this is our strategic plan for 2021, 2023. And I believe that's my last slide, and I will pass it on. Thank you for your patience in those technical challenges. Thank you.
Great. Thank you all so much. So we have a few minutes left here. I'm just checking the time at me. And I think right now we're going to take some questions from the audience. We have about 7 minutes for Q&A. So we'll take some questions from the audience. Mother Lab team members, you can turn your screens on. Thank you all so much. Thank you for all the love we're getting in the chat. This has been incredible. You guys look amazing and make me so, so proud. So I think we're going to take a few questions from the backstage room here. So the first question I see is about the systematic review. So this is for the research and grants. Where is the systematic review published? So Blessing and who else is here from research and grants? Blessing, you're here.
So the systematic review, there are two. So one is in press. So the first one is the one on policy, on like Black maternal health policy, a review of all the policies from 2010 to 2020. That is published in Frontiers. And you can also, we can try to drop a link in the chat for that paper as well. The second systematic review is in press, and that's the one on prenatal interventions. So that one should be coming out soon. So
great. Thank you. Blessing, you'll smile at this question. People are asking about how easy it was to access PRAMs. Can you talk about the process of acquiring PRAMs data?
Right. Yeah, sure. So it's an interesting process. So it's not difficult per se in that you just apply for it, but it takes time. So it can take a while to get the data set back from the CDC, but so long as your project proposal is sound and direct, you should get feedback eventually in like about 2 months. But other than that, if you wanted to like just use one state data, you just apply straight directly to the state PRAMs. But if you wanted data from multiple states, that's when you go through the CDC.
Great, thank you. Okay, keep the questions coming. Question I see is, what does it mean to have the opportunity to engage in this high-level work during your undergrad study? So let's start with that one. So I'm looking at Iman, Amaya, Lauren, who else is an undergrad here? I think those are the three we have in the room. Okay, so what does it mean to engage in this as an undergrad? And what do you think the expectations are? If people want to get involved, how would you suggest they figure out more about doing that? Or what has it been like for you all as undergrads being in such a high level, amazing lab?
I guess I can begin. So definitely for me, I think that when I first joined, a lot of it to get involved is you have to take your own agency and your own initiative. I think everyone in the Mother Lab is very action oriented and collaborative. So if you're ready to work part of a team and you're passionate about something, it's been a huge learning curve for me. And a lot of it, we navigated it together. We are a virtual lab, but working and being able to meet different community partners, working in legislation, was all from ourselves and getting involved ourselves. And when you have great leadership like Dr. A.O., anything's possible.
Come on, don't make me cry. We have 300 people in the room. Go ahead, Amaya, Lauren.
Yeah, just going off what Iman said, I think one of the things that I've noticed just being a sophomore in college is that having passion is the biggest thing, and having leaders that kind of show you the path is what has really helped me kind of connect with community partners and get involved in such a high level. And I think age is never a barrier when you care so deeply about these issues. So never let that stop you, and it's completely accessible to anyone.
Yeah, I totally get that. I didn't know that much about maternal health before joining Mother Lab. I had done a couple of smaller projects for different classes, but I just knew that it was something that I wanted to learn more about. And that's kind of what got me involved. So there's really no barrier to entry as long as and something you care about and are willing to put in the work for. I also didn't know anything about policy, and for a while I was creating the policy newsletters kind of single-handedly. So it's definitely a lot to learn, but it's also been a really, really great experience, because we've learned not only about the specific things I'm working on, whether that's research or policy, but communication and teamwork and other skills that are really transferable also, while we're helping to advocate for policies that will amplify the voices of Black women, which is ultimately what we're trying to do here.
Excellent. So I have a question here. Any more information on the abortion disparities group? People want to get involved. People want to know more about the abortion disparities work we're doing. Thanks. Anyone can.
So I'm part of the abortions disparities group. Where we're at right now is we've drafted a piece that we're looking to get published right now. So we're still submitting it. And we're just trying to stay kind of up to date on all of the changes that are happening state by state. As you guys are well aware, policy changes regarding abortion are coming out daily. There's brand new news every single day. So we're just kind of trying to stay on top of that while getting our paper published. And we'll probably be developing some more work in the coming months.
Yeah, and I also that definitely the abortion disparities and the barriers to access to care is an ongoing problem. And definitely, if you would like to get more involved, feel free to reach out to us through Mother Lab, and we would be happy to get back to you.
Very good. Okay, my backstage people, we are almost at time. We have 5 more minutes. Okay, we've been extended till 12:55. Keep the party. So the next question, I think I'm going to open this up, but I also want to hear from everyone here. Can others outside of the Tufts community engage in your work as a committee member? So here's the thing. Mother Lab is a virtual lab. We have people in the room from all over the world, not all over the world, all over the country. But we represent all parts of the world. We are West African, we are South African, we're African American, we are Middle Eastern, we're African American, we're white, we're Hispanic, we represent everything. And that's really the strength of Mother Lab. People have been chatting me like, wow, I didn't realize how diverse your lab is, which is one of our strengths and one of the things that I'm really, really prideful about and very intentional about curating who's in the space, because frankly, maternal health disparities and maternal health inequities, that crisis is predominantly seen in Black and brown birthing people. But when we lift and when we save the lives of women, we're shaping the world, right? So the work of Mother Lab, I always say Mother Lab to the world, but we really need to coin that term, you guys, because that's how I feel. It's Mother Lab to the world. Our vision, our excellence, our reach is in the world. So others, what do you guys think about how people can engage with us? I'm thinking of giving some examples of the community engagement work that we're doing here in the local Boston area. I know you guys spoke about that, other opportunities. And then a question I want to hear a little bit more from Kelechi, Allison, Heather. What has been your most impactful moment being in the Mother Lab family? So anyone can answer the questions about engagement, and those people in particular, what has been the most impactful for you? Allison, I think I know what you're going to say, but I want to hear from you guys. Thanks.
So I can start off saying I think one of my most impactful moments being on the Mother Lab is not just the publications that we were able to present specifically with the testimony. That was really amazing to do, that I got to spearhead this team of 8 of us on the Research and Grants Committee and investigate the racial disparities that exist within the United States and provide best practices and recommendations on how can we reduce that maternal mortality rate and help eliminate those racial disparities. But I think what's been even more amazing is getting to work on a coalition of so many diverse people and perspectives. We're not just undergrad, graduate students, PhD. We have so many people on this team from all across the nation, like Dr. Ao said. And it's all thanks to her leadership and all of the great work that we've put into this lab together.
Thank you. Heather, Kelechi, go ahead, hon. Yep.
I definitely second that. I started this lab while I was in my last year of undergrad, and right now I'm currently pursuing my master's in maternal child health at GWU, or George Washington University. So it's been an amazing journey to see how this lab has grown and to see how myself has grown as a maternal health advocate. And I'm just very confident in our future as being the biggest maternal health research lab going on.
Okay, great. Heather, anything you'd like to add?
Yes.
All right, we're getting a thumbs up. Yes, we can hear you, hon.
Oh my goodness.
I'll add it on your behalf.
So,
Heather is delighted to be here.
part of the meetings.
Okay. Well, we are having some technical difficulties. One of our amazing members. I'm going to go to the next question I see. As a student, are there any tips for research into action? How do we take from the policy place, which is the theme of the conference this year, into action? I want to do the research so it's available, but I don't want it to end there. So that's from the audience. So anybody on the policy committee, any thoughts? Lauren, I'm looking at you because the letter that you guys are putting out that goes to the legislatures on maternal health quality. Can we talk about that? Because I think that's really actionable, and that was like it's a low bar for getting the letter out, but the reach is tremendous. It could be super impactful. Do you want to talk to our audience about that?
Yeah, of course. So one of the things that we do in the policy and advocacy kind of subcommittees are really taking this research and putting it into practice. So as Dr. Ayo mentioned, we drafted a letter in support of the Maternal Health Quality Improvement Act, which we had our members send out to their representatives. And we'll be talking a little bit more about that later in our toolkit presentation as well. So definitely stick around for that. And we'll talk about different ways to kind of engage your legislature, to engage your legislators. So that's one of the main things is kind of finding a policy that you are kind of really passionate about and doing something about it, whether that's reaching out to your legislator or collaborating with other groups who are also working for the same things as you and advocating kind of as a larger group, which is something that we are doing as well. In addition to with the podcast that we've been doing with advocacy, reaching out to different people who are involved in maternal health and getting them on our show and kind of amplifying their voices as well.
Wonderful. Thank you all so much for this incredible opportunity today. I really appreciate all of the things that you guys have talked about. Mother Lab, your panelists' work has been amazing. Thank you for your efforts towards working to create a better system. We're now moving on to our next main stage session with the amazing, incomparable Congresswoman Ayanna. Session can be found in the lobby under the agenda tab. See you there. Thank you.